Hi, my name is Dr. Emil Toschi. So I wanted to make this quick video for you because we have a lot of parents that bring their children into us, especially babies, kids, toddlers, and stuff like that. And they want to explain to their friends exactly what happens when they bring their kids to our office. So I figured I'd make this quick video. So the first thing that's going to happen is you're going to bring your baby or your child in, and you're going to fill out an intake form. And in that intake form, we're going to ask you as far as symptoms, if anything's going on, like colic, reflux, ear infections, sleeping issues, going to the bathroom, if they get sick a lot, whatever it may be, right? Anything that they have going on, obviously we're going to talk about that. Then we're going to ask you some other questions. We're going to ask you things like, was the baby natural or C-section? Something to think about, right? Because remember, birth is traumatic, and according to Dr. Taubin, he's a Harvard-trained medical doctor, 93% of the time when they're twisting and pulling the baby out, it shifts the atlas, that first bone out of alignment, puts pressure on the brainstem. It blocks the connection between your baby's brain and the rest of their body. Okay, so we're checking for this interference which happens in the spine. So we're going to ask about that. We're going to ask if they fell from a high place. 50% of babies actually fall from a high place within the first year. That's according to the American Pediatric Association. So 50% if your child's fallen, that can also cause this interference that we're talking about. If they play any sports, we're going to ask about that. If they breastfed, what's their diet like? Those are the types of questions that we're going to talk about with you. How is the pregnancy? How is mom's health during pregnancy and stuff like that? We're going to talk about those things. So that's the consultation, okay? You're going to fill out the intake form. We'll talk about that information. Then what we're going to do is an examination. Now, you might be saying, how are you going to examine my child? So we want to check them two ways that are non-invasive. They do not hurt at all. The first way is with a NASA space certified infrared thermal scanning technology. It's right here. It's called the subluxation station. It's a thermal scan that picks up skin temperature, okay? They use this on the astronauts. This right here, which you'll get also, this is just 20. There's a ton more, but this is 20 referenced peer-reviewed research studies justifying the validity of this test right here, okay? And what we're going to do, it's non-invasive. I'm actually going to show you what the exam looks like on little Bryson right here. So he actually has been under chiropractic care for a long time, but I want to show you what an exam would look like. So what I will do is press initiate, and I'm going to check with an adult or with most children that can stand and that are bigger, we'll check their entire spinal nervous system. But with the little ones, what we'll do is we'll check C2, which is right there, and we'll check C1 on both sides. That's in the cervical, that's in the neck. Okay, so what we'll do is do this.
Begin scan.
And I just come right up to him.
C2.
And if I could reach, would be awesome. Here we go, little guy.
Left C1. Right C1.
Come this way, buddy. Look over here first.
Look. I'll turn the other way.
Yeah, there you go. I'm gonna get you. Oh. Good.
Quick and easy.
Okay, so you can see if it lights up, because a normal scan is supposed to be clear, and most kids actually have interference, so we're going to save that one. So any interference is going to show up as color, so that means that there's interference there, and we haven't adjusted them today yet, so we'll clear that out for him definitely. And then the second thing I'll do is actually we'll lay him on his back, and I'll actually palpate him. I'm going to make another video for that to show you actually with my hands. I'm just feeling gently for these joint restrictions, or this what we call subluxation, this interference. So we'll lay him on his back and we'll actually do that, and then we'll do a light adjustment. So I'm going to make another video to actually show you that. All right, I hope this helps.